I take a yearly physical every year, and went and had my yearly physical, and my PSA level was up to like 4.8. So the doctor recommended that I go in and have it tested. So I did, and found out I had prostate cancer. In Wenatchee Valley Hospital there, they had just gotten a new robot in to do prostate cancer called the Da Vinci. The recovery time was unbelievable. I was probably walking the golf course in 2.5 weeks. The prostate cancer surgery was February 8th. The anesthesiologist, when he was putting a breathing tube down my throat, saw a spot on the base of my tongue, which you couldn't see it just by looking there. We went and had it checked and had a biopsy done on that, and by golly, that come back cancerous too. I retired December 23rd. I found I had prostate cancer December 28th, and then to have throat cancer, I'm saying, whoa, what's going on? And so we talked to the doctors there, and they said they don't do this type of surgery in Wenatchee, that I have to go over to Seattle, a place called Seattle Cancer Care Alliance. So we went over there, and that's where I met Dr. Mendez. With this surgery, normally a person would have 12-hour surgery and your jaw broken and put back together again, and having a feeding tube for 3 months. And he said, but we also got the Da Vinci robot. I said, well, Dr. Mendez, I've already had a Da Vinci robot surgery. And so then I told him about the prostate. He was excited about that. He was excited about the robot because of the less intrusive surgery it was. They went in and took a golf-sized ball divot out of the base of my tongue. I'm out of the hospital in 2 days. I feel very little pain during this period of time. I'm swallowing pretty good. I'm eating kind of soft foods, nothing heavy foods, but I'm eating soft foods. It wasn't until about the 4th day that it decided it would give me some problems and start hurting. It was pretty sore for swallowing and stuff like that for about 5 days, 6 days maybe. And then it kind of subsided, and probably about 2 weeks it went back, so I could go back to soft foods and swallow and stuff like this. And after that, I mean, we're only talking probably 4 weeks after surgery that I could swallow just about anything again. The only time it affected my talking was when it swelled, and it was hard to do anything then. It was hard to talk, it was hard to swallow. After that stretch, my talking, it didn't bother my talking at all. By this surgery, I negated a lot of the pain and agony that I could have had. I would say, if any way possible, to do Da Vinci surgery. It's so much better as far as the recovery time, quality of life you're going to have afterward. And I would recommend it to anybody. If they were going to call and talk to me, sure, absolutely.